Hey there. So you think you're destined for hip replacement surgery? I think I am too. I've been diagnosed with severe osteoarthritis in my right hip, and I'm getting ready to have surgery. Before that, though, I have a consultation with my surgeon to ask all the questions I need to ask about pre-surgery, surgery, and post-surgery. And I don't think I have all the answers. In fact, I don't have all the questions. Maybe you have some extra questions that you would like to ask. Maybe my questions will help you when you are thinking about getting hip surgery. So let's see how this goes. I'm compiling a list of questions to ask at my pre-surgical consultation. And if I miss any, you can help me add some. So comment below and let me know if there's any questions that I've missed. So a little background here. I'm almost 70 years old, and like I said, I've been diagnosed with severe osteoarthritis in my right hip. Bone on bone. I went to my orthopedic surgeon and he showed me an x-ray. He showed me an x-ray of a good hip, and then he showed me an x-ray of my hip. And he goes, you see this area right around the ball in the hip joint? That's not good. And to add everything else on top of it, I have bone spurs as well. So that's a little extra bonus pain that I'm experiencing. I'm having trouble walking. I'm even having trouble bending over to tie my shoes. And let alone, I can't play golf anymore, which is something I truly love to do. And I'm hoping that the process that I'm going to go through is going to help me get back to playing golf and get me back to all the activities of daily life that I need to do to be able to enjoy the rest of my life. And hopefully this is the only hip surgery that I need. And hopefully this will be the only hip surgery that you need as well. And like I said, since we don't do this every day, every week, every month, I have questions. I'm not experienced at this. So I'm going to be asking lots of questions to my orthopedic surgeon. So I'm a true believer in the saying that if the only tool you have is a hammer, of course, every problem is going to look like a nail. And with that, of course, my orthopedic surgeon is going to be recommending hip surgery because that's what he does for a living. However, after a long consultation with him and the daily pain that I'm going through, I kind of figured that hip surgery was probably my ultimate destination. But I also believe that with something so severe, you want to try to escalate up to that eventuality. Try some other things less invasive prior to that to see if something may work that doesn't require surgery. So I asked my orthopedic surgeon if physical therapy could be a path for this to start with. And he goes, of course. We can always try that. So he signed me up and to get a physical therapy appointment. And I went to the physical therapist and she did a wonderful job of testing my flexibility, my mobility, that kind of thing. And I failed all those tests. She concluded that, yeah, physical therapy is not going to help with what I got going now. And possibly that the orthopedic surgeon was correct in saying, yeah, you're going to need hip surgery, hip replacement surgery. So off I go to the next step, escalating up. So the next logical step in this journey was to get a cortisone injection. And my surgeon agreed that a cortisone shot could help and help ease the pain. However, he cautioned me that because of getting the cortisone shot, if I did want to go ahead with hip surgery, it would delay that surgery for about 3 months, allowing for all the cortisone to get out of my hip and get cleared out. He also mentioned that the cortisone shot would probably only last maybe a couple of months. But I thought, if it's going to help, it's going to help. We should go ahead and go for it. And we'll see if that can be a more permanent solution for me. So I went ahead with the cortisone shot. That was a horror show. The injection process was extremely painful, and it's something I never want to go through again if I don't have to, let me tell you. It was uncomfortable, it was painful, all those things. And yeah, I just didn't want to do that again. However, with that said, after about 3 or 4 days, my hip did start feeling better. I started to be able to walk again a little bit. I could, at least tie my shoes. So the pain had been mitigated to a good extent. It was still there, but it was, less. And the cortisone was doing its thing. The other thing was, instead of a couple of months, the cortisone only lasted about 4 weeks. And I was right back to where I started from before the injection. Same level of pain, same level of inflexibility. And on top of all that, my inevitable surgery was delayed was delayed 3 months. So cortisone, in hindsight, was a mistake for me. Was a mistake for me for sure. So on to surgery. So now I'm back to where I was. My hip is killing me. I can't walk. I can't do anything. Heck, I can't even put on my own socks and shoes. And now I'm delayed getting my hip surgery. So my consultation again is here next week, and I'm going to be asking questions about the surgery because I know that's my destiny now. At first I was resisting it, and now I'm accepting it. In fact, I'm looking forward to getting it done because once I get it done, I start my road to recovery, which is the most important thing. So let's go through the questions I'm going to have for my surgeon, and I'll let you know how that goes. All right. Well, let's get into the questions I'm going to be asking my surgeon next week when I have my pre-surgical consultation with him. First off, what surgical approach are you going to use? Will it be the anterior approach, posterior approach? It makes a difference in the recovery process from what I understand. So which process are you going to use? What kind of anesthesia are you going to use? I know there's something called like a spinal block. And I don't know how that works, and if he's going to use something like that, how is the surgery going to progress? How long should the surgery itself last? Is it going to be an hour, 2 hours? I don't know. We'll have to find out. What are the risks? This is the big one. What are the risks of the surgery? And I'm sure this will be the majority of the conversation. Lots of papers to sign and clearances and authorizations and all of that, and tell me what could go wrong, right? Is my age and weight an issue? Obviously, I said that I'm close to 70 years old, and I'm not the smallest person in the world. I have a pretty high BMI. So is that going to be an issue during the surgery or for the surgery itself? What type of implant or material are you going to be used, and how long is it expected to last? There's different kinds of materials out there from what I've been reading. What are you going to use? What's going to be best for me? Will these materials set off airport metal detectors? Excuse me. I travel a lot, so is that going to be an ongoing inconvenience for me when I go travel? So for the doctor, how many types of surgeries have you performed like this, and what are your complication rates? Have you had any kind of major complication rates for your surgical processes? I don't know. We'll have to see. Are there any pre-op classes that can help me prepare for the surgery? Is there something I can go to, ask live questions as they come up? before my surgery? I don't know. And what should I bring to the hospital on the day of the surgery? Do I need to bring my own walker and cane or wheelchair? I don't know what I should be bringing to the hospital for the surgery. So those were the questions for pre-surgery. Now, I have a lot of questions about post-op and what to go through after the surgery is complete and I get home. Speaking of that, how long will I be in the hospital after surgery? Some people walk out that day. Is that the expectation here? I don't know. Will I be spending overnight? I don't know. How much pain should I expect? This is a good one. And how will it be managed, both in the hospital and once I get home? Will I be given pretty good narcotics to be able to mask the pain? Hopefully I don't have to use them too much. But if they're needed, hopefully they're there. I don't know what the post-surgery pain management process is. And then obviously physical therapy is extremely important after the surgery to be able to get back on your feet again. How does all that work? Do they set up the appointments for me? Will they be coming to my house? I don't know what the actual process of getting physical therapy after the surgery really is. What movements or daily activities should I absolutely avoid during recovery? Is there certain leg movements, certain angles, certain things that I should avoid? Is it week by week that I get stronger and stronger? And what should I avoid at the beginning? What should I avoid later on? And I know everybody's different on this, but what's the general timeline for recovery from this kind of surgery? I know full recovery, probably 9 to 12 months, something like that. But are there intermediate stages that are milestones that we should be looking out for? And then when can I drive again after surgery? Again, my right hip is being operated on, and I know from what I've been reading that they don't want you moving your foot back and forth like this right after surgery from the accelerator to the brake and back again, and emergency movements and all that. How long does that restriction last? And I have a swimming pool in the backyard, which I think would be great for post-op recovery. When can I use it? Is there a certain period of time that I need to wait before jumping back in the pool? I'm sure there is, but I don't know. And some more post-op questions. What equipment do I need to assist me with my activities of daily life? I probably will need a walker. I probably will need a cane. Do I need a booster seat for my toilet? Do I need something to help me get in and out of bed? Fortunately my wife will be here, so she'll help me like with my socks and shoes and things like that. But just getting in and out of bed, how is that going to work? What equipment would be best to have? And for me, I'm a side sleeper, right? And I know, having your legs crossed over and all that, there's lots of different complications. Is side sleeping a problem? I think it is. How am I going to do that? Are there techniques that I could do to be able to avoid sleeping on my side? Or if I do sleep on my side, is there a way to protect my surgically repaired hip? I have a recliner chair, so can I use that to sleep in? I've heard both sides. I've heard people say, yes, you can. I've heard people say, no, you can't. So which is it? Is it yes? Is it no? What does the doctor recommend, one way or the other? And I'm sure this will be covered through physical therapy, but what type of exercises should I be doing at home after surgery? I'm sure there'll be a long list of exercises and walking goals and all of that for me to get to. But generally, what types of exercises should I be doing? How much walking, speaking of walking, how much walking should I be doing after recovery? Week 1, week 2, week 3, week 4. Again, my ultimate goal is to be able to walk 18 holes, walk and play 18 holes of golf. And I'll know that I'm pretty well fully recovered when I can do that. Will I need to be walking to be able to build up strength? So what's kind of that general schedule for walking? Taking a shower. I know they don't want you taking a shower immediately after surgery, and there's a few days in there. How long do I have to delay taking a shower before I heal enough to jump back in there? And those were kind of the post-op questions. And now, questions specifically about golf, returning to golf, which is, again, one of my big goals. Can I even return to play golf again? I'm sure it's a possibility, but what are the percentages of me being able to do that actually? What's the general timeline for returning to play golf? What are the different phases? Maybe after 4 weeks, 6 weeks, I can go to the putting green and putt around. Maybe a little chipping here and there. Who knows? I need to know what that process is. Will there be any permanent restrictions for hip rotation? Because there's a lot of hip rotation in golf. Are there going to be any permanent restrictions after my surgery and long-term for my game? Am I going to have to completely change how I swing? I don't know. Questions. Does the doctor determine when I can return to golf, or does the physical therapist determine when I can return to golf? Who's kind of in control of that process for me? And then what specific exercises can I do to help get back to golf? And I'm sure, again, that'll be covered under physical therapy, but these are questions I want to be able to ask and find out. And I know once I return to golf, I'm going to play 9 holes to start with, or maybe I'm going to be using a golf cart a lot. How long should I plan on using a golf cart? I like to walk the course, and that's my ultimate goal. But a cart is going to be very helpful in the beginning to get back. So how long should I expect to use the cart before I can start walking the course again? So those are kind of my general questions, and I know I probably have missed some. I know that you probably have better questions to ask than what I've detailed here. This is the list that I kind of came up with. So if you have more questions that you think I should be asking, please send them to me. Please, comment below and let me know what those questions are and what I should be asking my orthopedic surgeon. But again, I want to say thanks for watching, and stay tuned for more videos on my journey to my hip replacement, and something now that I'm looking very much forward to. So until the next video, I'll see you later, and we'll talk to you soon.